Welcome to our webinar titled Caregiving, How and Why. Thank you for joining us. I'm Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors, Amogen, Alexion, Apellis, Tahoe Oncology, and Merck, and the support of our generous patients, families, and caregivers for supporting the webinar today. Each month, we host support groups. Our support groups are virtual, and the support groups are led by patients and caregivers just like you. You can find out more about our support groups on our website at aamds.org. You can register directly through the website. And once you register for a group of your choice, you'll receive an email. That email will be your confirmation email. It also will include the login information for you to join that support group of your choice. This webinar is meant to be an interactive webinar, so there'll be times throughout the presentation that our presenter, Jane, will be asking for your feedback. What you can do is open up the Q&A box on the right-hand side of your screen, type in the comment, and then what we'll do is I'll read everyone's comments aloud. They will be anonymous, so we won't be sharing your names. And this is also the way that you will also submit questions for Jane throughout the presentation. I do ask that you do not include private health information in your question. Jane will not be able to answer any specific questions related to anyone's diagnosis or their health care or suggestions for treatments. We will do our best to get to all questions today. I'd like to introduce Jane. Jane Hamilton is a registered nurse. She's also an educator and an author. Jane has been a nurse for over 40 years and a family caregiver for over 20 years. She is nationally known as a caregiver advocate and speaker. Jane has several books dedicated to caregiving, and we can help you with those books if you are interested. And I'd like to thank Jane. For many years, Jane has been a friend of the foundation and a strong advocate for helping us with educating and supporting caregivers. So it's my pleasure to welcome Jane today.
Well, thank you, Lee, for that wonderful introduction. And I will share my screen. Are you seeing my screen right now?
Not yet.
Okay, so you do not see my screen. Okay.
Just you.
Show here we go. I'm trying.
You're fine.
I tell everybody that I used to be practicing clinically as a psych nurse, and I went into psych nursing so I wouldn't have to deal with machines and equipment. And now here I am dealing with Zoom and slides. Now, can you see my slides?
Absolutely. Looks perfect, Jane.
Hallelujah. Thank you very much. And thank you for that lovely introduction, Lee. What I want to say to all of you who are listening is welcome, and I am delighted that you're here with me today. As Lee has said, I've been a nurse for many years, and I've been a family caregiver for over 20 years, caring for my husband and my parents and my in-laws and some of my friends. And what I discovered when I took care of my family members as opposed to patients in the hospital is that there is a more deeply felt and more meaningful quality to being a caregiver to loved ones, but it is also not an easy thing to do. And it was through my own personal experience with family caregiving that I created the Partners on the Path, which is the work that I do with family caregivers. And I've written a book on the Caregiver's Guide to Self-Care, because as I went through my experience with caregiving, everybody said, oh, take care of yourself, take care of yourself. But my question was, how do I do that? I've got too many balls in the air, and it is really a challenge to find the wherewithal to carve out time to care for me while I was caring for my husband or my parents. And so it is some of the things that I learned through my own caregiving journey that I have put into our webinar today, which I'm calling Take Care, But How? But how? And so I want to talk with each of you about practical things for you to consider doing to care for yourself as you care for your loved ones. And so I want to say that we will see slides as I go through the session today, but I also have provided 3 downloadable documents that Lee has shared with you. I will refer to these as we go through the program, but you can download them if you haven't already and refer to them after we're done talking today. So let me start out by talking about a bit of an overview of what it is we're going to do today. I would like for us to spend some time allowing you to reflect on your own caregiving experience and to engage with us, and this is sort of the interactive part of our session, about what is self-care. And we'll talk a bit about why it's hard to do and why it's so important. And I would like to add to the presentation 4 healthy self-care practices that I found effective for myself and that I've written about in my book and that I've spoken about for many years in presentations that I've done for family caregivers. And I'd like to close our session today with a question asking you to consider what you can plan to do that would be reasonable and a helpful way to help you manage the challenges and the stresses of being a family caregiver. So there are a couple things that I've learned, and I want to start with the fact that caregiving can seem very solitary. I found that I felt lonely sometimes. I was carrying my own worries, and nobody could really take some of those worries and concerns and tasks away from me. But what I want all of us as caregivers to know is that while it is a solitary experience on some levels, we are not alone. Our former First Lady, Rosalind Carter, made a famous quote several years ago where she said that there are only 4 kinds of people in the world: those who have been a caregiver, those who currently are, those who will be, and those who will need a caregiver. In her model, what she's telling us is that caregiving is a universal experience that will touch everybody's life. And so it is, on some level, something that can draw us together. And we know that in the United States, there are over 53 million people who are caring for loved ones every day. And so we may be handling a private and personal experience, but we are not alone. But what I also have is another quote for you, and this highlights a paradox about caregiving, that while caregiving is universal, it is a uniquely personal experience. Your experience of caregiving is a little different than mine, and even if you have a sister or a brother who is caring for your loved one also, their experience of it will be filtered through their own lives. And so this other quote that I found is, when you've seen one caregiver, you've seen one caregiver. We cannot say that all caregivers are alike, even though the experience is shared by others. My challenges, my responsibilities, my pain and loss, my feelings about what I'm experiencing will be uniquely my own. And so think about this as we go through the session today, and listen for the things that are universal, but think about your own unique experience, because in looking at the uniqueness of what you're experiencing, you will then discover what are the things you need to do to care for yourself. So over the years, I learned that there are 5 things that all caregivers experience, and these are the things that are universal: stories, stressors, the toll, the needs, and self-care. We all have a story, but recognize that while we all have a story, our stories are all unique. My perception, my experience, the situation where I cared for my mother who had dementia is clearly different than your experience as caring for a family member with aplastic anemia or MDS. So the stories are unique and uniquely personal, but everybody has a story. Second of all, there are always stressors, things that will challenge us. And I'm going to talk with you in depth about what are some of those experiences at the tasks that we do and the challenges that we face that generate the stress. What we know, thirdly, is that all caregivers have some kind of a cost. There is some kind of a toll that is taken on our sense of well-being, and it impacts on our capacity to care when we are worn down. So attending to the toll is one way of learning how to begin to take care of ourselves. The fourth thing that everybody experiences is that we all have needs. We have a need for resources to help us do the work of caregiving. We have a need for energy within us to do the work of caregiving. And we all need partners to help us, because caregiving is a team sport. So universally, we have needs. And finally, the other universal is self-care. When we care for ourselves, we do things that promote our own health and our well-being, and it preserves our ability to be a good quality caregiver, not short-tempered or harsh or forgetful, but one who can be really present to the person in our care. So those are the 5 universals, but let's look at some of these more closely. And I'd like to talk about the things that are stressors. We have one of the downloadable documents is called Caregiver Assessment. Why am I so stressed? And I encourage you to look at this after our presentation. We are stressed, first of all, by the work of caregiving. The tasks are things that I have to do over time. These change over time as the condition of my loved one changes. The caregiving tasks are physical care, where I may feed or bathe or dress or groom or help somebody with walking or getting to the bathroom. And not everybody has the same experiences with physical care. Again, that's where the personal uniqueness comes in. Caregiving tasks involve personal affairs like managing medicine, finances, legal issues, insurance, care coordination, or transportation for the care receiver. Thirdly, we have household tasks. I may cook, clean, shop, launder clothes, do home repairs, or help with relocation of the person who is in my care. And the other set of tasks that are affiliated with caregiving are emotional or social support, calming someone down, cheering someone up, helping them to connect with other people, helping with behavior or mood disturbances, or making sure that the decisions that have to be made, I can help them if they're hard decisions to make. So those are the tasks associated with caregiving. And note that they're not all like nursing tasks where you're taking care of somebody's physical health, but there are a number of things that caregivers do. The second source of stress or the second set of stressors for caregivers are what I call caregiving challenges. I can feel unprepared for the responsibilities and the expectations that have fallen to me, handling complicated medical or nursing care, even though I don't have any kind of clinical training. I could find caregiving to be unpredictable. I don't have control over when there's going to be a medical emergency or a crisis arising, and unpredictable in that I didn't choose this. I didn't ask for this to happen, but here it is, and something I have to adapt to. The demands of caregiving, thirdly, can feel unrealistic. I can feel overloaded given all of the other responsibilities and roles in my life. It can be that my to-do list has many things on it, too many things, in order for me to be able to function. And so it feels like the responsibility is unrealistic. And I can feel unsupported. Maybe my family members are not stepping up to the plate. The help that they give may be inadequate. They may be critical of what I am doing. And so undermining my sense of contributing in a constructive way. They may be AWOL and not doing anything, or even some of the care partners who are professionals may not appreciate the challenges that I face as a family caregiver. And so I may feel unsupported. I may feel upset. Many times we're grappling with an undercurrent of loss. The person who I knew before this diagnosis is somebody that has different qualities than now they have as a result of this diagnosis. I can have a sense of anger or frustration, sadness, or guilt that here I am healthy and this poor person is just struggling so hard. So there are a lot of emotions tied in with being a caregiver. And finally, the challenge can be financial. I can feel my word is underfunded. I may be paying money out of pocket for caregiving expenses, and it may not really fit into my budget. Not all of us are multimillionaires who can handle big financial expenses. And so I may be foregoing income. I may have to spend my savings. And so there are financial challenges that go along with this experience. And finally, what I want to say about these stressors is that it helps to be able to recognize these and to be able to articulate those to people who are in our families or who are our friends, so that they can get it, if you will, so that they can understand what it is that is stressing you out. But, you know, it can be hard sometimes to communicate these, to put your finger on it, because sometimes I just have this nebulous feeling of being distressed. And so come to this list and consider it when you have to talk with your loved ones about your experience with caregiving. So beyond the stressors, I want to talk about a little why it's important to recognize and respond to caregiver stress. And it's in large part because of the toll. Caregiving on average goes on for 4.5 years. So it's a chronic stressor, and we know that chronic stressors lead to minor and major ailments. In fact, 60% of caregivers report that they have poorer health since they have taken on this role. On a mental health level, depression and anxiety is more common among caregivers, and caregivers use medications for depression and anxiety at 2 to 3 times the rate of the general population. And financially, what we know from the research is that anywhere between $7,500 and $10,000 a year is spent on caregiving expenses of many kinds. And so what we know financially, it is stressful. And in terms of family relationships, there can be conflict about who's providing care, what kind of care, why did you do that in the way that you did? There can be financial disagreements. There can be conflict in terms of being a sandwiched caregiver. That is, I'm caring for young children, but am also caring for an older party. And so I'm not only providing childcare, but I'm providing care to someone who is ill. And so I feel squeezed like in a sandwich. We can also know that 70% of caregivers report, those who are 60% are employed at some time during their caregiving experience, and 70% of those report some kind of disruption in work, coming to work late, leaving early, having to take calls during work, maybe even having to go to part-time or to resign because of the responsibilities. And so what we know is that there are aspects of our well-being that are impacted by the responsibility of caregiving. And we know also that the stress of caregiving can have an impact on the quality of care that we give, the capacity to care well, being a healing and positive presence to our loved one, providing high quality care, and having the perseverance to go through the caregiving experience, no matter how long it takes. Sometimes the stress of caregiving can take a toll on our capacity to care also. So what I want also now to talk with you about is that that universal aspect of caregiving is that we all have needs. So we have the need to have positive personal energy, that we need to maintain our physical and emotional and social ability to see things positively and not be exhausted or depressed. We also have a need for practical problem-solving resources. We need somebody to answer questions, somebody to come in and actually physically help us out to do the tasks that need to be done. We need to have answers to our questions, somebody to listen to our concerns and help us work it through. So we need practical problem-solving resources. And finally, we need partners on the path. We need care partners, both in our families and in our professional physicians and doctors and nurses. And the AAMDS Foundation is a partner on your path. And by combining these three, by getting all three of these needs met, we can promote our own well-being, promoting that and diminishing our vulnerability to the stress of caregiving. So now I want to just close this and ask you to think a moment about your own caregiving stories. And I'm guessing you thought about, what are the stressors? What are the tasks and challenges that stress you? What are the signs that your physical or mental health, your well-being, and the quality of your care may be suffering because of the stress of caregiving? What are your needs for practical problem-solving resources? What kind of positive personal energy do you have, and what kind of boost do you need? And who are your partners? And finally, what I want us to think about as you consider these, what about your self-care? Now I want to shift our focus towards self-care. And Lee, this is the part where I'd like folks to jump in and join us in our presentation. So it's always much more enjoyable if it's not just Jane Hamilton speaking, but if people who are part of the group can contribute as well. So my question for you is, first of all, how would you describe self-care? What is it to you? And what are some signs that you need it? Can you share some things with us in the chat?
All right, we'll give everyone just a couple of minutes here and see what folks are going to put in the chat.
Okay. How would you describe it, Lee?
What is self-care? I
Yeah.
think I would say self-care is taking care of yourself.
Uh-huh.
Because I think when you apply taking care of yourself, you're better equipped to take care
That's
of
right.
those that you're trying to
Yes.
take care of.
Yes.
I think, and it, one of your questions is why is it so difficult? Because it's hard to do for yourself when you feel your focus is supposed to be 100% on someone else.
Yeah. And then you
And I
start to
think
feel
there's guilt.
guilty, right? Yeah. Uh-huh.
Yeah,
Yeah.
there's the guilt.
Mm-hmm.
So we have one response to what is self-care, and it's one person says doing something nice occasionally for yourself.
Okay. Doing something nice. That there's an action, there's a doing.
Mhm.
Something nice so that it feels good. I hear the word occasionally, and I'm going to highlight that and say frequently would be my encouragement to everyone who is listening. And I'm going to talk with you about the specifics of self-care practices. It's anything that helps you and anything that helps you to feel healthy and calm, positive and resilient. Anything that is healthy, that helps you to feel calm and positive and resilient. And it will vary from person to person. So maybe I have had a running injury, and so I can't jog, but so instead I walk or I swim. Well, maybe you like to jog, and that's self-care to you. So each of us has to do what works well for us. So why do you think it's so important?
Jane, one person said to go back to question one, what
Uh-huh.
is self-care? It says here, um, time for myself.
Mm-hmm.
Alone time for
Mm-hmm.
myself
Mm-hmm. Mm-hmm.
is
Yeah.
self-care.
Yes. Yes.
And
And
we'll give a minute and people can answer your second question about why is it important.
okay, so what are your Lee, what are your signs that you need self-care?
I think that when you're caring for others, I think it's being able to recognize in yourself frustration
Mm-hmm.
or that you're not feeling well.
Mm-hmm.
And
Mm-hmm.
that can be very difficult because it's very hard to look at yourself
That's right. Yes.
and recognize when you're feeling stressed.
Yes. And one of the things that my husband used to say to me, you're getting brittle. And I would sort of get, sort of short tempered and frustrated, and words would come out, and I would be a little short. And those little behavioral signs can be indicators that you need self-care. Hopefully you see those before you get to the gigantic ones where you have a huge meltdown or where you become sick because you haven't cared for yourself. So why is it important? Let's talk a bit about that.
Jane, I have a comment.
Okay.
It says to the question, why is self-care important? It
Uh-huh.
says, so you don't lose yourself.
That's right. That's right. And caring for another can be so um, overwhelming that you can lose yourself. And when you lose yourself, that's when you start to do things that are not healthy or you feel unhealthy. And what I will say is it's difficult partly because of that guilt. It's that sense that this person is sick and I'm healthy, and so I need to give everything to them. It's also tied to 21st century life. We work and we work, and the computer's on all the time, and we're always responsive. And self-care is saying, no, you have to stop sometime. And I think the other element that I want to say about why it's so difficult is that we overlook the cost of overfunctioning. when we go, when we do, okay, I can handle it. I can handle it. And when we do too much without a break, it's like the Titanic sailing towards the iceberg. They never saw the iceberg and they crashed. And it's important to know that there are icebergs out there, and we need to look for them and avoid them by practicing self-care. So let's talk a bit about what actually is self-care and what are the practices.
Jane, real
Yes.
quick, we had a comment about why is it so difficult?
Yeah.
And that was, it's difficult for me as I don't have other supports to fill in.
Mm-hmm. To actually have somebody come in and do the hands-on element of caregiving.
Right. Right. They don't have family. I'm assuming this means they don't have family or friends that can step in so they can step out
Right.
of the role.
Yes, and that is one of
The
that's
respite.
one of the really important challenges of for caregivers, is to recognize that's imperative, that you find somebody to give you a respite or take some time off to refill your I liken it to a big pot of soup, and a caregiver is ladling out the soup into people's cups or bowls, and you're caring for your loved one, and you're doing more and more ladling out. But if you don't refill the soup pot, you don't have something to give. And so it's absolutely critical that caregivers give ourselves permission to take the time and give ourselves permission to find the resources so that I can take the time. So when we have self-care practice number one, what I'm talking to you all about is the importance of caring for your whole self. We as human beings are holistic. You've heard that term. We are made up of many interrelated and interdependent parts. There's physical, intellectual, your mind, occupational, that's your work. There's spiritual, which can be secular or religious. There's the financial part of our life. There's a social, that's that interactive and play part of ourselves. And there's the emotional part. And when we take care of ourselves as a caregiver, we need to care for all of those aspects of our lives. And what we know is that anything I do to feed my physical self by getting a good night's sleep or eating a good meal or drinking, plenty of water, or going in and getting a checkup to make sure that my health is well, all of those things that I do for my physical self, feeding that part of me will add energy to all of me. So if I have a self-care need, I need to pick out what works for me, and what works for you may not work for me. So what I have in one of the handouts that you can download is called What Healthy Self-Care Practices Would Nurture Me? And there is an inventory of things that you can select from, and that will sort of, what should I say, stimulate your thoughts about ways to care for yourself. On an emotional level, working off your anger with physical exercise, learning how to say no, asking for what you want, resolving conflicts with people. All of these are ways to care for your emotional self. Mental is things like asking questions when you have them, daydreaming, actually relabeling a difficult situation and saying, I'm doing the best that I can. So mentally reframing it in a positive way, or thinking optimistically, like this is difficult, but tomorrow can be a better day. Again, social is connecting with other people, playing. Sometimes it's taking time alone. The spiritual is praying or meditating or being in nature, reading something inspirational, or going to an art museum and appreciating something of beauty. So spiritual can be religious or secular. And on an occupational level, it's learning how to do some of the tasks that you need to do, and also having boundaries so that, okay, this is my time away. I'm not going to think about my tasks right now. I'm going to read this book, or I'm going to watch this funny movie. So there are some very practical, easy to do, hands-on things to help you care for yourself, care for your whole self. Remember the airplane advice: put your oxygen mask on first before trying to help others when the plane is in danger. Same thing for us as caregivers. We need to care for ourselves, because if we can't function, we won't be good caregivers. And remember the idea that self-care is not selfish. It is a way to promote your health and well-being, and it is a way to preserve your positive energy so that the care you give is good quality care. So for the person who said occasionally, I would like to encourage you to think about regularly practicing self-care. And the second thing I'd like to suggest in terms of the regular practice of self-care, I just gave you some ideas about what to do, but the second strategy is what not to do. And what I call stress numbing are all of the self-medicating kinds of things that are really not healthy ways of caring for ourselves. Oh yes, I like ice cream just as much as anybody else, or cake, or a glass of wine. But it is stress numbing when it is used to deaden the pain, and when it is used in place of healthy self-care practices. So eating a lot of junk food and overeating, emotional eating, smoking, drinking to excess, too much time behind the screen, or going off on huge buying sprees that are going to put you in debt. All of those things, get our mind off of the difficulty, but they can, when used to excess, create other problems like obesity and addiction and debt. So the idea is to think about your choices in terms of self-care and choose ones that are healthy. So those are the choices to avoid. And I want to look at a couple more ideas on healthy choices, which I started to talk with you about. Again, I'm going to direct you to that sheet that says what healthy self-care practices would nurture me. And this is an action plan which has a place where you can check off, okay, these are the things that I do. I like to do certain things, and so I am going to do those if they're healthy. And then what I would encourage you to do is to think about one or two new fun things, or pleasurable things, or relaxing things that would help you to feel better. Again, it's this idea about thinking about your choices and make sure they're good ones. It is through our choices that we create our lives. And if we are going to be healthy caregivers and healthy individuals in general, we need to be able to make choices that will make that happen. I want to go to the section on financial, and which I did not mention earlier. There are a number of sources for financial support. If you're finding that caregiving is having an impact on your finances, and you're concerned about that. And I'm going to give to Lee these citations that she can post following the webinar. The Consumer Financial Protection Bureau, which is a part of the federal government, an offering of the federal government, has consumer finance help for you. There is an organization, it's a nonprofit called needhelppayingbills.com, and they can help you figure out how to find the finances that you need. There is another organization called findhelp.org, which can help caregivers to find free resources or resources at reduced cost. And finally, there is through NORD, the rarediseases.org has patient assistance programs that can help caregivers find respite and funding for respite. And so we'll be sure to put those up after the webinar, and know that there is financial assistance out there if you are worried. So what I want to highlight here is that when we make choices that are healthy, they help us to stay in balance, and they are things that will help us to persevere, and they are things that will help us to feel well as we go through our caregiving experience. And so I encourage you to think seriously about what healthy choices can you practice on a regular basis. And the last self-care practice I would like to recommend is what I've touched on already, the idea of committing to regularly practicing self-care, not making it an afterthought or something I'll get to maybe if I have some time, but that it becomes a regular part of my life. And so the fourth self-care recommendation I will suggest is that we commit as caregivers to self-care, and recognize that you're not a machine, I'm not a machine. We are living organisms who have energy that ebbs and flows with the responsibilities we're handling, with our health, with the challenges that we're facing. And as our energy flows out, it's imperative that we replace it. We can't plug into the electrical socket like a light fixture and turn it on and the light goes on and on and on and on with connection to an external source of energy. No, we are living and organic beings, and our energy comes from within, and we need to manage the balance of responsibilities in our life to access the energy that we need to live. And so my first suggestion, and this picture of the dental images here is that I want to liken self-care to good dental practice, that little things that we do with dental care every single day. We brush, we use good toothpaste, we floss, we go to the dentist, and those little things that we do add up to good dental health. Little things make a difference in dental care, and similarly, little things that you and I do that are kind to me. And some of the people who contributed earlier, Lee, touched on the little things that are good for me, that make me feel good. Those things are very important, and they add up over time. So first of all, admit that you do have stressors, and that they can and do sometimes take a toll physically and emotionally. Admit that you have some needs for support, and admit that it is okay to practice self-care. So beyond admitting your needs, the second thing to do is to permit yourself to practice self-care. Self-care is not selfish. What I want to highlight is self-care as a practical strategy for preserving your good health. When we look at self-care as a health promotion strategy, it helps us to embrace it and give ourselves permission. And so it is vital to our health and to our well-being. So when you have a little voice in your head saying you shouldn't take the time, no, they need you more, that don't do this. When you have that voice in your head, turn around to that voice and say, don't say that. I need this, and we will find a way to take care of me and to take care of my loved one. I need to find a way to make that happen. Give yourself permission, and finally commit to putting self-care on your to-do list every day. Plan and follow through, as I mentioned. Little things mean a lot. Think about also, the dental care. You can think about having a bucket or a jar, and you put in a penny every day. And you put in a penny every day, and another day, and another penny, and another penny. And after a period of time, you've got a whole jar full of pennies. You have filled up that jar by your deposits. And so think of self-care as depositing energy into your heart and your soul and your body and your mind, so that you can rise to the challenge and provide the kind of care that you so much want to provide, and to do it in a way that promotes your own health and well-being. So make a plan to see yourself as not a caregiving machine, but as a living human being. So admit your need, permit the practice, and commit following through on doing little things for yourself on a regular basis. So in closing, what I'd like to ask is, on behalf of the Aplastic Anemia Foundation, are there some things you would like to say, Lee, or are there other things or questions that people have put forth?
Sure. So we have both.
Mhm.
So we'll go that, but let's start with the questions first,
Great.
Jane, and then I'll give a little bit from the foundation. So Jane, our first question is, Jane, have you ever experienced working with caregivers who say that their loved one resist them being their caregiver? And I'm assuming this means they give them grief for wanting to do so much for them.
Mhm.
And if so, any suggestions on how to respond and to your loved one?
Mhm. Well, that's a tricky one, because I don't know the nature of the relationship between the person who put the comment out and their loved one. I always go, based on who I am, to talking about it. What is it about what I'm doing that's a problem? What is it that is upsetting you about this? What would you like to see instead? How could we do this in a way that you would feel comfortable with, or that you would be more accepting of? And I think so having some kind of discussion and asking for the care receiver to describe what it is that they want would be important. I think the second point that I would think about is this an issue related to safety? and there is, I think safety for me is the bottom line, that I can't agree to do something that would put somebody's life in jeopardy or put them in an unsafe situation. But if it's not an unsafe situation and they need to assert their own their own sense of agency, their own self-control, maybe sometimes I need, as the caregiver, to let somebody do something on their own. Sometimes my own desire to be helpful feels like I'm taking away the care receiver's independence or diminishing their strength. And so there's a delicate balance there, I think, that needs to be assessed. So I unfortunately don't know the individual, but safety, asking questions, and making sure that the person feels that their own sense of agency is respected.
Thanks, Jane. I'm glad you mentioned the word balance, because our next question says, I'm having difficulty balancing caregiving, meaning my need to help the person I'm caring for, and then really determining what do they really need help with.
Mhm.
How do you find that balance?
Wow. Well, I mean, is that sort of similar to the point I made before, that you have to have a conversation about this? What are the person who is ill has lost something in terms of their own self direction. Would you agree to that one, Lee? So that they've given something up by becoming ill, and we don't want to take anything away from them. So there has, on some level, maybe discussing, so what do you want? And I have a need as a caregiver to make sure that you're safe.
Yeah, I think sometimes, Jane, some of the things that we hear is that for a patient, they want to do more than sometimes what the caregiver allows, because the caregiver feels they need to do everything.
Yes.
It's kind of finding that balance.
Yes.
I think of, and then, but I think this question, it's seeming like it's meaning they think the person they're caring for could probably do more for themselves than what they're doing. And how do they approach that? The finding that balance.
So it's like two
I
sides.
think it's kind of a flipping.
Yeah, two sides of the
Yeah.
same issue, which is what is the balance? And if somebody says, oh, well, you should do that for me, and oh, I can't do that, or oh, you should do, and then you're running yourself ragged because you're doing everything and the other person isn't taking any role in doing what they can, that's the other conversation that has to be had. So I think maybe the issue of balance is something that has to be worked out in any situation, in any case. Taking on too much responsibility would diminish or decrease the sense of autonomy and strength of the care receiver, but having them do less than they can is feeling like being taken advantage of and not supported as the caregiver. And that's not good either.
Jane, we have another question for you. And this is about distance caregiving. It says, I have some family members that do not live locally, but they do want to help. Have you worked with any families where there is this is like distance caregiving?
Yeah.
And have you known this to be successful? And how can I go about involving them when they don't live locally?
That's I lived 900 miles away from my mother and father when they were not well, and my sister was the local person taking care of everything. And so I would go to visit, and when I went to visit, she would get a break, and I would sort of step in and do some of the things so that she could, take some time off and just take care of herself. I think depending on what the situation is, you can always, as a long distance person, and call and check in with the caregiver. So if you're the caregiver and the family is far away, ask them to call regularly and talk with me about what the experience is. Schedule time to come and help. Sometimes people who are at a distance can be involved in doing research about a certain kind of treatment, or can help with financial issues, or paying. I was going to say paying bills. I'm not sure that helping with taxes, perhaps, or helping with the move. So what are the I would go back to the list of tasks and challenges that I just used to describe what are the sources of stress, and to look at that list of emotional and social support. Somebody can be at a distance and can provide a whole lot of social and emotional support, and we have Zoom now that everybody is so used to. And we didn't have that when my mom and dad were not well. So I would go to the tasks and challenges on that document and think about what can you ask the other people to do in support of you as the caregiver who is on the scene, and ask them and tell them how hard it is and how much you need their involvement.
Thank you so much, Jane. And I'm going to go ahead and just give a little thing from the foundation. So this month is National Caregiver Awareness Month, but caregivers care every day. So honoring caregivers and their importance to the patient journey is every day, not just once a month. 1 month out of the year. So caregivers are the unsung heroes. They face the challenges of caregiving every day, which most caregivers are not prepared to undertake. There's no formal training on how to be a caregiver unless you decide to go into nursing or be a physician, or most people who are providing caregiving take it on with no support and no training.
Right.
So thank you to all the caregivers from the foundation for all the support that you provide to your loved ones every day. Your value to the patients is priceless for everything that you do every single day. I want to let you know that the foundation is here to support you just as we do your loved one, the patients, every day. We do host every month a family caregiver support group. Each month the support group is virtual. So you're able to join wherever you are and participate in the group. You're also welcome to join any of our other groups, even though you may feel like that they are the patient groups. We have many, 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 many caregivers who join with their loved one, the patient, and participate in the group. So please feel free to join any of our virtual groups. Those groups are led by patients just like your loved one. Our caregiver group is led by someone who provided care for their child when they were going through transplant. So I just want to let you know that as a foundation, we are here to support you and your loved one every step of the way. And thank you for participating in our programs. Thank you for being here, always in support of the foundation. It means so much to us.
Well, I thank you, Lee, for inviting me to present to your caregivers. It's always a pleasure to work with you and an honor to interact with your caregivers. And I wish you all well. And I encourage you to honor your gift, which is your loving care of your loved one. And while you do that, honor yourself also by practicing self-care. Thank you.
And thank you, Jane, for sharing your time and your expertise with all of us today. This webinar will be available on our website within just a few business days if you'd like to watch again. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us and trusting us as your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 40 years. This concludes our webinar. Thank you, Jane.
Thank you, Lee.